everyone. So I'm Fiona and I run the library at the RCPsych. I actually stepped in at the last moment to run this webinar, so I really hope you like it and that everything goes swimmingly. It's the first one that I've done. I'm going to be talking about how to find the evidence for your research and practice, basically starting at the point that you reach for your computer or your phone with a question. Hoping I can suggest a few new resources that you might not have used before and maybe help you search the ones you do use more efficiently. So sessions like this about using databases can often be incredibly dry. So pre-COVID, I would have tried to do this in person and make it as interactive as possible. So now that we are post-COVID or current COVID, I'm going to ask you to ask as many questions as you like all the way through. I'd like this to be as interactive as possible. So please use the Q&A function rather than the chat. And in aid of it making it more interactive as well, I have Luke here to help me, who's going to relay your questions and hopefully ask some of his own. So do you want to introduce yourself, Luke?
Thanks, Fiona. So my name is Luke Baker. I'm ST6 German Adult Trainee in the Royal Navy, and I'm the current chair of the Psychiatric Trainees Committee. So Fiona, thank you for inviting me today to do this session with you. I'm really looking forward to it. And thank you for giving me permission to ask questions as we go. So if I butt in, it's not that I'm being rude. Fiona has given me permission to ask questions as we go to make this as interactive as possible. So thanks, Fiona.
Brilliant. So I'm just going to start sharing the slides. Okay, so we're doing finding the evidence, database searching, and other information sources. So I'm going to start out with what seems to be the problem. What is everyone's top frustration with access to electronic resources? So this will help me maybe change the session a little bit as we go along. If everyone is having the same problems, if you are having a problem, other people are probably having it too. So please tell us what it is. And Luke, what are your top frustrations with electronic resources?
So Fiona, I think my problems with looking at data sometimes is where do I go? Which database should I be using? And sometimes I get it wrong and I waste time because I've gone to the wrong one. Other times, all of the vast array of different logins I have can sometimes be difficult, and understanding where I can get access and where I can't, and that frustration when I can see that perfect article and I don't have the right login for it. And then once I've found where I think I'm going to be searching, how do I make my search as efficient as possible so I actually get what I want and I don't end up with irrelevant articles? And then once I've got those articles, how do I sort them out? And what can I do to try and save some time rather than having to go through them all? So I know I've just fired a few things at you, but there's some of the frustrations I have when I'm doing this. Okay, so we're going to be covering a lot of that, which is really good. And if I miss anything, please do remind me at the end. But also just to say that those are really common problems. And if you find yourself going around in circles, not being able to access the article that you want, getting really frustrated, you're not alone. This happens to a lot of people. And in some ways, it's stacked against you because we would love to give you the easiest access in the world. But A, technology is always difficult. And B, some people would rather that you paid for things. Or your NHS access isn't working very well with your RCPsych access. All of these things can cause problems. So I'll talk about some of that today. And if it's anything like my run through of this presentation, I will also get caught in the same traps. So you'll see me get it wrong, and then I'll show you how to put it right. So let's talk about what we're going to cover. So we're going to sort of start at the top level evidence databases and work our way down. The sort of meat of the session is going to be a live demo of using the NHS and the RCPsych databases and doing systematic searching, because that is the most difficult thing to do. But before that, we'll talk about point of care tools and we'll talk about high-level evidence databases. And then afterwards, we'll do a little bit on open access and some useful apps for you and possibly your patients as well. So the current climate. We're all exceptionally tired of learning to use new softwares, I'm sure. Between Zoom, Teams, House Party, whatever you've been using to socialize during the pandemic, doing the 1,000,001 quizzes that happened during last summer, we're all a bit exhausted.
So I applaud you for coming to the webinar to start with and learning a bit more, but sadly we're only expecting this to continue. And I would just say it's fine not to be an expert on all the databases you use. Somebody is, and you can just find them and ask questions. I have done more one-to-ones with people on how to use the databases in the last 10 months than I probably ever did previously, and all online. So there's always places for you to ask questions. So this is a brief bit about the Topol review, which was produced by HE a couple of years ago. And it looked at how the NHS is going to deliver the digital future. And possibly leaps a little far into the future. One of the use cases that I've picked out, which was about mental health, is a mental health triage bot, which is using AI to help with the GP IAPT pathway and where to put patients. So it's all very exciting if you're into AI and robotics. But I think in the interim, learning how to use some of the current databases is also a good idea. And it's very much a popular topic at the moment, improving people's digital literacy. I know it's one of the college priorities, and making sure people can get to that evidence and that it doesn't frustrate them too much on the way there. So, Luke, can I ask you, what was the last thing you looked for when you were looking for evidence? What kind of things do you look for on a regular basis?
So I suppose that they fall into two categories for me, Fiona. On one hand, sometimes I'll look for maybe nice guidelines or try and look at other clinical guidelines if I'm faced with something that I may not be certain about. So that's one thing that I'll look for. The second, I suppose, pillar is when you're doing any research. So at the moment, I'm looking at leadership and management within military healthcare settings and trying to find papers that may have already been written on that as part of a literature search. So I suppose one hand is the clinical guidelines, and then on the other is different research that we may or may not be doing.
Yeah, and I think that's a really good point. So it can be good to separate out the sort of day-to-day questions from the research questions. So I usually see people when they're thinking about writing an article or updating a book, writing a chapter, or doing a bit of QI work, that kind of thing. So that's when people are going to be doing their systematic database searching. It may not happen too often, and I would encourage you, I will show you how to do all of this today, but the librarians are here for a reason. You're very welcome to just send me a literature search and ask me to do it for you. And your NHS librarian will do the same. Half our job. So if you are looking for a guideline on a sort of day-to-day basis, one of my favorite resources, which I think is underused, is the Nice Evidence Search. So I know a lot of people will probably just put maybe anorexia, nice guideline into Google, and that will give you what you want. It's a great thing about Google. But Nice Evidence adds a little bit. So let's jump out of the presentation and do that live. So even if you search Nice, you'll probably get that because you'll come to this normal home screens with the pathways, guidance, BNF access, that kind of thing. But the evidence search is helpful if it turns out that there isn't a guideline, a nice guideline for what you want. So if I was to search anorexia, that would be part of the Nice Eating Disorders guideline. But there's other stuff out there. So you can go onto Nice Evidence and search, and then you can even filter down to guidance. And you'll start seeing guidance from places that isn't nice as well. So you're getting the Royal College of Psychiatrists marzipan guidance, and I think the guidance for children is on here as well. You're getting the Canadian Paediatric Society, more Royal College, Cancer Care Ontario, and all of these resources have been sort of pre-approved by NICE. They don't get onto NICE Evidence without being decent quality. And you can use it to search for other things as well. If you wanted to, for instance, get some information for a patient, again, there's sort of pre-appraised information for the public on here as well, which you can just download and print out. It's a good place to find that. So that's Nice Evidence, which I really recommend having a look at. Go back to here. Point of care tools. So these are also known as clinical decision-making tools, and they're really increasing in popularity. So here's some examples. You've probably heard of some of them, if not all of them. So Dynamed, UpToDate, and BMJ Best Practice are the top ones. The NHS has bought BMJ Best Practice for all staff now, so you can access it. And if you're accessing it from an NHS terminal, you probably won't even have to log in, which is great. So what do these do? They sort of bring together regularly updated research evidence along with expert knowledge in order to help you make clinical decisions. And they offer a sort of step-by-step approach to manage diagnosis, prognosis, treatment, and prevention. So it's basically like having a massive online textbook.
Fiona, may I ask you a question, please, that's come in from someone? Because I think this is a good time to ask. So one of the questions is, if people don't have access to whether it's Athens or journals or some of these apps that you're talking about here, because, for example, they're not working in the NHS at the moment, how best can they gain access to things like this? Is there a way for people not currently in the NHS to have access to some of the things we're talking about today?
For the point of care tools, no. That's pretty much just institutional access via the NHS. Unless, of course, you're a member of a university or something which is buying these. The universities tend to buy all of them, which is great for the students, but not so good for the actual staff who are working later on. In terms of accessing things like NICE evidence, that's free to everyone. I mean, I would look at it as a patient, but only because I'm a health librarian. And journals and Athens access, you can get through the college. So if you're on this webinar, you probably do have Athens access. You just need to drop me an email and ask for an account. So I think my email is being posted in the chat, or you can just Google RCPsych library website and send me a message and I'll set something up for you.
Great.
But yeah, point of care tools, not so much. They're very expensive. And one of the downsides of point of care tools is that they're not as good yet on mental health care. So it's not something that it's worth the college buying until they improve. So I realize that makes it sound like, why am I talking about them? But I know for any of you who are working with inpatients, sometimes the physical healthcare stuff is still going to come up. And I would encourage you to help improve these resources as well, because I think they're going to be really important moving forward, because they are kind of replacing the standard textbook. And because all staff can access them, it's really great if someone working anywhere in the healthcare sector puts depression into BMJ Best Practice, that they'll get the right information back. So if you see something wrong, please make sure it's fixed. And I've done this before. I've contacted BMJ Best Practice and said, it doesn't match up to the NICE guideline. And they come back to you very quickly and say, we'll fix it, or there's a reason for that. So yes, so they're like a massive textbook, but one that links in directly with the BNF and gets updated pretty much constantly. So they're a really good place to go. They're really fast, and the information is very practical. The treatment algorithms are really good. And they sit really high up in this pyramid of evidence. So I'm sure you're all familiar with the idea that you don't go straight to an RCT if you want an answer. You'd always consult the guideline, or failing that, a systematic review first, because it's pre-appraised evidence. You don't want to have to run a full critical appraisal on an RCT to check that they had the right number of patients and that they were doing all the right stuff before you get your answer, because that's just so time consuming. So they sit right up at the top because they have been pre-appraised by people who know what they're talking about already. That's really good. That's BMJ Best Practice. You can see here, that's your login by your institution if you're not on site. Again, they have really good patient leaflets, which are downloadable and again, pre-appraised, so they meet all the accessibility standards. There's an app. It's free. You can download it and use the whole thing offline. But because you're downloading all of it, it'll take up quite a lot of space on your phone. And you will need to set up a personal account. So if you don't think you're going to use it regularly, I'd just use the browser version. Okay, so moving on from point of care tools, here's a few systematic review databases. These are all free to access. Cochrane Library is probably the most famous, and something really nerdy. If you haven't noticed, their logo is a forest plot, which I really like. It's one of their early, really impactful systematic reviews, and you can see the little meta-analysis there as well. So just a shout out to the stats nerds. Other ones are DARE, which is the NHS Centre. And Epistemonikos is quite new, multilingual database based in Chile, but that one is really gaining popularity. Its interface is really good. And if you're looking to combat that kind of geographical language bias that you often get in evidence, that's a really good place to go. And it's easy to filter to English if you're not looking for other languages. Okay, systematic database searching. This is the sort of meaty part of the presentation. So before we hop off into a NHS or RCPsych database for a demo, let's just talk about some theory. So before you start searching a database, which most of them can be used in a sort of Google style way, you can just put in your search terms as like free text and they'll give you an answer. But if you're trying for that kind of efficient searching where you know you haven't missed anything and you're not getting back lots of irrelevant results, then it's worth thinking in detail about your question before you start. And there's a few different ways you can divvy up your question, and the most famous is PICO, which divides any question into population, intervention, comparison, and outcome. So you can see here I'm doing patients with early onset schizophrenia, comparing clozapine and olanzapine for reduction of positive symptoms. And it's mostly an intellectual exercise, but it helps you think about exactly what you want. Because if you confuse your topics, your concepts within your search, when you're searching, you can get some really irrelevant results. Because if you accidentally mix up olanzapine and reduction of symptoms or something like that, you're going to get the wrong things. But that said, PICO doesn't fit every question. You can just divvy up into different concepts. That's generally what I would do. I would just create a grid if I was doing something really detailed with sort of 1 to 4 concepts, concept A, concept B, etc., etc. Now, Boolean searching. This is one of those things that most people have heard of but can't remember what it is, because unless you're a librarian, it doesn't come up on a regular basis. So this is about combining search terms and using the and, or not functionality. So when you use or, that's used to combine different search terms. And this is about translating your search into something your computer and your database will understand. So we know that when we search psychosis, we probably also want psychoses and psychotic, but your computer doesn't. So you do need to search all those terms separately. And then you can combine them on an OR to pull all your results together into one block of your concept without missing anything. So once you have that concept with all your different terminology, you can then move on to combining it with other concepts. So that's searching on an and. So here we've got our search terms from before on psychoses. But what we're actually looking for is articles on cannabis and psychosis. So we need all our search terms for cannabis as well. And you can see here that you might be looking for an article on cannabis, but the article that you really wanted to find was calling it marijuana. So you didn't find it because you didn't search marijuana as well. So it's important to search all these variant terms. But that said, and this is something you maybe need to think about when you're doing your question, you need to know whether you're interested in cannabis or cannabinoids more generally, and be specific about that. So then when you've got your 2 pools of results, you can combine them using an and then you'll only get the results that have both cannabis and psychosis. Now this is a simple example, but you can imagine that if you're getting up to sort of 4 concepts or concepts which relate to each other differently, then it becomes more complicated. And here's your search string down here. This is what it looks like. So psychosis or psychoses or psychotic and cannabis or marijuana or THC or cannabinoids. And that's a really short string, but if you were to work on a systematic review or be reviewing a systematic review, you'll see very long search strings. because sometimes there might be a lot of terminology that needs to be included. So a couple of search tips. There are many different ways you can use different forms of punctuation to change your searching. There's only two that I would really draw your attention to and suggest that you use regularly. So that's phrase searching. So examples, mental health or frequent attenders. You don't want to search all the articles with mental or all the articles with health or frequent in. You only want those words in that order. And that's what phrase searching will give you. So you just need to put those quotation marks around your phrase. And the other one is truncation. So I would usually truncate child, just down to child, because that will give me children as well. And psychiat with a star, because that will give me psychiatry, psychiatrist, psychiatrists. And the same with schizo. So I would regularly use that, despite the fact it makes me slightly uncomfortable because it will give me schizophrenia, schizoaffective, schizoid, that kind of thing. But be careful how far you truncate. If you're looking at scans, for instance, if you abbreviate all the way back to scan, you will also pick up things like Scandinavian, which can bring you, again, lots of results that you didn't want. So be careful with that one. Usually I just use it for plurals. Okay, NHS access. Let's jump out and look at the NHS databases. So I would usually find them just by looking for NICE. It's going to take me to NICE evidence, but that's fine. And then up the top here, which I can't get to because of the Zoom meeting. There we go. You can click journals and databases. And healthcare databases, advanced search is what the NHS uses to search databases. So that's what you're looking for. Now you don't need to log in, but if you don't log in, you'll only search PubMed. So much better idea to log in. And that is a wonderful example of how your computer will get confused if you're logged in on the wrong OpenAthens account. It won't tell you that that's what happened, but that's essentially what's going on in the background. So I'm going to go to OpenAthens directly. And I'm on my RCPsych account, which is what it's recognized, so it won't let me into the NHS resources. So I need to sign out. And I'm going to re-navigate to HDAS so that it doesn't remember, hopefully. Log in. Okay, so that's my RCPsych account. If you have both, you can tell the difference because I'll start with RCP and your NHS one will start with NHS. So now you're logged in, you can see a lot more databases. There's 9, I think, for the NHS, and you can see what they are if you hover over. And there's some that you probably won't want to use, so the nursing databases. And there's an informatics one as well, which I don't use very often. But the ones I use regularly are PsycInfo, most regularly. And then Medline for general medicine, Embase has drugs and pharmacology slant on its general medicine. So that can be really helpful if you're interested in a particular drug. But we'll start in PsycInfo today. You can, as I said, use this as a Google style search. You can search all, and that's fine. And if you're doing a really detailed search, sometimes it will show you exactly how many results you're going to get from different databases if you run it through the search all first. I would go straight to the database you want because it allows more functionality. So the search I'm going to run today, unless anyone has something they would particularly like me to run, is antipsychotics for emotionally unstable personality disorder. Because I've checked and it doesn't give me too many results. So let's start with antipsychotics. Now I'm going to use an asterisk because that will pick up antipsychotic medication as well as antipsychotics and such. Now at this point, I would recommend naming your strategy because that will save it and you can come back to it later. If you don't save it, you risk losing the whole thing. So we searched for antipsychotic and we've got about 30,000 results. But that's fine because we're going to combine it and narrow that down. Now, if you're doing detailed searching and trying to be systematic about it, you should always use free text searching, which is what this is, combined with your thesaurus. So if I click on thesaurus, it's going to search antipsychotic in there, and it's going to give me antipsychotic drugs. Now it's rearranged and it's saying, okay, do you want to search on neuroleptic drugs? So I don't know if you can see it on my screen, but my little windows for Zoom are hovering right over the wrong thing here. So there are scope notes around here, which I hope you can see, which you can click on and check if you're not sure you're going to be clicking on the right. So I looked at this before, and neuroleptic drugs is the current name for antipsychotics used in the database. So that's how you use the scope notes. Otherwise, you've got some different options here. You can explode. If you select explode, it will search this and every subheading. So it's just a quicker way to include all these individual antipsychotic names. Or you can major. Major means that you'll only get articles which have stated that neuroleptic drugs are a really important theme for that article. But usually I would just click select. So now I've got our antipsychotic and our neuroleptic drugs, and I would select both of them because these are essentially synonymous terms for us, which can be combined on an or. So we're going to select or and combine. So that's our concept one. Now we can move on to our personality disorder. So we're going to search this as a phrase. I'm going to put an asterisk on there and close it as a phrase search. Okay, so we're not getting too many results. Very convenient. And I'm going to use EUPD as well. Now, if you're searching on an acronym, you need to be really careful that that acronym isn't being used for other things as well. So if I scroll down, I can see the results from EUPD, and that's fine, okay. But that one looks, I don't recognize any of that. So I could check the abstract. And EUPD, new estimation procedure, and this is coming from structural equation modeling. So that's probably not the EUD we're talking about. So it's worth checking that kind of thing. I had someone who was searching on IV, like IV fluids, and they were getting everything about stage 4 cancer. So just keep an eye on that. That's another way you can get results that you didn't want. That's okay, because it's only giving us 10. So we'll try our thesaurus search.
Fiona, may I ask sorry, Fiona, I just thought I'd jump in and ask a question, right, just while you were typing that in. A couple of people have asked questions around gaining access to what you're doing now. We've talked about RCPsych Open Athens versus NHS Athens. Can you just be clear if that, depending upon which one you log in, gives you different access to this, for example?
Absolutely. This is a really key point about Open Athens, which confuses people quite often, is that Open Athens in itself is just an authentication software. It just allows you to have one single sign-in for every journal that we provide. But you can have as many institutional Open Athens accounts as you want. So you might have one with the NHS, one with the RCPsych, and one with the university, and they will give you access to different resources. So depending on your trust, again, you'll have different resources to another trust, because trusts buy extra on top of what HEE provides. So one trust might have access to Lancet Psychiatry and another might not. So depending on your trust, you might need to come to us for some of the specific psychiatric journals, because we're more likely to have bought them than the NHS. And then again, the universities tend to spend maybe 30 million a year on electronic resources. So if you have access via a university, they may have the best collections, but it depends on the subject you want. So I'd recommend having as many accounts as you can, but they do cause problems because you'll probably see it when I try and log into the RCPsych databases. They'll recognize me as NHS and they'll go wrong. So you need to make very sure you log out of one before you log into another. I would usually do it with different browsers. So I'd have a browser for RCPsych and a browser for NHS, or I'd use the in-private browsing to make sure it doesn't get confused. So if something's going wrong, check you're using the right account. Hopefully that answers that.
I think that does, Fiona. And this one that we're using now, you need an NHS Opens Athens account to access, just to be clear for everybody.
Yeah, that's right.
Great, thank you.
We'll move on to the RCPsych access in a minute. Okay, so where did I get to? We had just found that there wasn't apparently a thesaurus term for EUPD. So just to check that, because the thesauruses aren't great a lot of the time at saying, oh, did you mean? They don't have that built in the same way that Google does. So I'm going to search for personality disorder more generally. And here you've got your list of personality disorders. So I can check that there isn't an entry for EUPD. But you can see that if you were looking for many other types of personality disorders, you'd be able to search on that specifically. I'm not going to search on personality disorders more generally in our search, because then it will start bringing in antipsychotics for other forms of personality disorders, and the results will get very confused. So I'll close that. And now I can combine these because they're synonymous terms. So we've got our concept 1 for antipsychotics and our concept 2 for EUPD, highlighted in green. And then we can combine both of them on an AND, which gives us 5 results. At this point, if you realize that you should be seeing more than 5 results, you can go back and look at your search terms. If I thought there should be more, my first instinct would probably be that people aren't talking about neuroleptic drugs and antipsychotics. They would be talking about a specific antipsychotic, and therefore I'd need to go back and add in clozapine, olanzapine, all of that to the search to make sure that that wasn't what people were writing in their article. But I won't do that now because this is just a demo. So once I've got my results, I can look through them down here and click here to show all the abstracts. And if I was to say, yes, I'm interested in that article, and I'm interested in, am I on the right thing? Yes. Okay, I might only be interested in the first article. Let's really hope my battery lasts for the rest of the presentation. And add to saved. Then I can then go and look at my saved results. And the joy of using HDAS is that I can transfer my search from one database to another. So if I decide I want more results, I can say, let's transfer this onto a different database. So you can't transfer a subject heading, which come up in capitals, but I can say, let's take antipsychotic, emotionally unstable, and EUPD and rerun them in Embase, because that has pharmacology slant. I really need these windows to be somewhere else. There we go. Rerun selected. And there you go. You've got all your searches running in Embase. So if I was doing this, not a demo, I would then rerun neuroleptic drugs in Embase and recombine my searches and have a look at the results that come off of Embase. You can see we're getting slightly more results on this database, so it probably would be good to have a look through Embase as well. And if you want to filter your results, that's not something we really need to do here because we've only got 5. You can do that by the very not intuitive way of taking the number of the search line, which for us is 7, and typing it in here. Clicking on limits. And then you can say, I only want articles from the last 10 years. And I read English and Portuguese, so I'll have those languages. And then pressing search. And then you can see we've got a new line, which is line 7, filtered to the last 10 years in English or Portuguese, which hasn't actually changed our number of search results. But that's how you can narrow down. So if you've got 500 results, then you can take it back to only the last 5 years. Or if you're searching on a medication and you don't want older articles, you can do that as well. If you're searching on COVID, you're only going to get the last year or so anyway. So that's the NHS databases. You can export articles really easily as well. So you can click on your search row that you want to export and should have a button for export around here, yes. And it's saying, what do you want to export it as? So do you want PDF, Word, Excel, or RIS? So RIS is the file type that you need to export to a reference management software like EndNote. So if you're working on a systematic review or something like that, you might be exporting 500, 700 articles. You'd probably want to export them in RIS. But if I click PDF, so file, then I will get a really nice report. That looks like this. So nice contents page, and then you will get links.
I think we may have lost Fiona. Her laptop may have died, which is a bit disappointing because we were just finding out how to use this export of data. So hopefully Fiona will come back very soon. I think she just needs to plug in her laptop. So hopefully it won't take too long. Just while we wait for her to reappear, thank you everyone for asking questions. Lots of them are coming in and I'm trying to ask them as we get to relevant bits. Please do keep firing them into us. At the very end of this, hopefully there will be time for some questions, which will be a more general theme if I haven't slotted them in throughout the presentation. If I don't ask your question or Fiona answers it, she will have a selection of them and put them up on the website afterwards. So if your question isn't answered today, have no fear. Fiona will be sent them, and she's kindly already agreed that she will provide answers and upload them to the website. And I can see Fiona back.
Sorry, Luke.
No worries.
Okay, so I'll just pick back up again. So that's the report you get if you export from the NHS databases. So I'm going to move on now to the RCPsych databases, which will probably be a relief to anyone who is in private practice or abroad. Now, I'm going to open up an in-private browsing window so that it doesn't get massively confused about the fact I've already logged onto the NHS databases. Because I tried this earlier, and that was actually the best way to do it. So my favorite way to find the RCPsych library is just to Google RCPsych library. And then we have standard library services such as book loans. You can look at the library catalogue online. There's no one actually in the office to send books to you right now. So we'll go with access journals and databases. And then you can see we've got some of those same databases we were looking at before. So Medline, PsycInfo, and Embase. You can also search for a specific journal or an ebook, and I'll show you those in a little bit. But if I just replicate what I was doing before on here, so EUPD, all the same functionality is in these two different ways of access, but it does look a bit different. So we've got PsycInfo. I'm going to put in EUPD. And here you get the option of which fields to search in. You do also get that option in the NHS. It defaults to searching title and abstract. I default to searching abstract on here because if it's mentioned in the abstract, it's probably mentioned in the title as well. We'll search that. And then in order to see what you've searched, you just need to open up your search history. So again, we've got those 10 results for EUPD. We'll put in emotionally unstable. Search that in the abstract as well. And then again, you see you've got the same functionality to just select those search lines and combine them with an or an and. So I could run this whole thing through again, but I won't because that will get very boring. So I will just show you quickly a couple of other things. So if I wanted to access, so you can check here what journals we have access to. It isn't a complete list because you get a lot of journals bundled in when you buy a database. So this is more what we have in addition to that. But if you want to check if we have access to a journal, that's a good place to start. So if I wanted the Journal of Affective Disorders, which a lot of people seem to at the moment, I can search like that. Link out to the publisher's website. And then you should already be logged in. That does tend to break down. So if you have any problems, just give me a shout. And if you aren't logged in, it will tell you, you press the right button somewhere around here, it will tell you that your access is provided by RCPsych. And if it doesn't, you can find the login button, and then you're just looking for either an Athens option or an institutional login option. You could go directly to the publisher's website. But one of the things that causes the most frustration is the fact that if you go to, let's say, the Journal of ECT, although we do have access to that one, and log in, it will still tell you that you don't have access to it if we don't subscribe to the journal, but it will send you in a permanent loop of logging in and never getting access. Without ever telling you that you don't have access to it, it will just ask you to log in again. So that causes so much frustration for people. So it's worth checking if you do have access to a journal, if you're getting into that kind of loop.
And Fiona, another question has come in around different ways of accessing some of these search engines. So if you're accessing through, let's say, through NHS or Athens, would the search results be different depending upon which access you're using, or would the search results always be the same?
They should be the same. I assume you mean NHS or RCPsych.
Yes, so whichever login you use.
So if you were searching on PsycInfo, or rather through the NHS or through the RCPsych, the results should be the same. But if you sort of do a search all type option, the results could be quite different because we're providing access to different resources. But if you're searching in a specific resource like PsycInfo, it should be the same.
And that was another question that's come in about, should people be doing searches then on both their logins? Do you do dual searches to get the best results?
It depends what you want. So even if you're writing an article, maybe searching 3 databases would be enough for you. And you could do that through the RCPsych, or you could do that through the NHS, depending on your personal preference. If you're doing a systematic review, or you wanted to be extremely thorough for some reason, then yes, you might want to do it on your different logins to pick up absolutely everything. But it's worth checking with me or with your NHS librarian if you're not sure exactly what additional resources you'll get access to save yourself just duplicating work for the sake of it.
Great, thanks, Fiona.
Okay, so that is how you access a journal. And I'll just show you access to the Maudsley ebook. So we just bought the Maudsley Practice Guidelines for Physical Health Conditions in Psychiatry, which I'm far too excited about, but it's really nice to have it on there accessible for everyone. And we also have Maudsley Prescribing Guidelines. And you can download these as a PDF, or you can search online. And you can search within the book as well. So you could say, what was I last searching? Weight gain in antipsychotics. So in some ways it might be easier than using the physical book. It depends how well you know it. So yes. And then I've got various stuff about weight gain or weight loss, which antipsychotics cause the most weight gain, that kind of thing. So they're fairly easy to use. If you have any problems, again, just get in touch with me. I may say that a lot. If you find you don't have access to an article that you want, we do run an interlibrary loan service. So if you're getting into that frustrating loop and it's because you don't have access, give me a shout and I'll tell you if we can get it from another library for you. And that's a free service, but we do limit you to 5 a week because otherwise people tend to give us 50. Okay, I'm going to jump back into my presentation just to finish up. So if any of you are thinking this all sounds very complicated and why can't it be simpler? Open access is gaining steam, and 2020 is a very exciting year, even apart from the vaccine, because Plan S has come into effect in January. So that was an open access initiative intended to make it mandatory for scientific research funded by public grants to be open access. So all of those institutions you can see there, now everything that they fund should be free to you for you to see. And it also means that your funder pays your article processing charge if you're an author. So some people will find that very exciting. Another good way to increase your use of open access is a browser extension called Unpaywall, which you can add to Chrome or Firefox, and it just means that you will get a little padlock, little green padlock in the corner of your screen if you're looking at an article which is free somewhere else on the web. And then you can just click on it, get access to the open access version of it rather than the paid version. And then in terms of apps, I'm just going to run through quickly so we have time for a few questions at the end. The BNF app is great, can be downloaded and used offline. I do get questions sometimes from people saying the RCPsych has stopped subscribing to the BNF, which we have. but that's because it's freely available to all NHS staff on the NICE website. And it's actually freely available to everyone on the NICE website. It's just they don't want you to use it if you're not working for the NHS or consulting it as a patient. But it just wasn't cost effective for us anymore when so many members already had access. So this is updated regularly, available offline. It's a really nice app to use. And then the NHS have an apps library. These are aimed at patients. So there's over 20 mental health apps on there. So you might find something that you wanted to recommend to people. Some of them are free, some of them aren't. Yeah, but there's some good stuff. Okay, questions? Is there anything you want me to run through again? That was quite fast.
Fiona, thank you for giving us that whistle-stop tour today. It's quite clear that this is a very complex area, isn't it? And there's an awful lot to learn. And certainly I'm going to have to go back and put this on the website and have another look through, because there's some really interesting ways of searching and reminding me about. So thank you for doing that. I suppose there are a couple of questions that have come in that I'll ask you about now. And you've touched on this a little bit already, but I wonder if you can give us some more advice. So this frustration people have using Note and Mendeley when people are doing research. You talked earlier about downloading the information off of the databases into that file format that's compatible. Do you have any other advice that can make sometimes that transfer of data easier?
Not really. I'm not claiming to be an expert in any of the reference management softwares, although I can probably point you in the right direction if you do need help. I don't use them on a regular basis. Something to mention is that I know in the trust that I last worked for, you could get EndNote accounts and EndNote training from the NHS library, but only if you asked for it, because they had a limited number of accounts for EndNote. So they only handed them out to people who really needed them. So check the resources that you have. If you're with a university, they will have really good reference management software and guidance for you. There's a huge amount available online. But yeah, RIS is the one to look out for if you need to export to reference management software. And I would really encourage you to start using it if you're dealing with results in the hundreds, which most people aren't. But if you are, it's well worth it.
Great. Thank you for that, Fiona. And another question that has come in is around, and again, you've partly touched on this, that interface that many of us find ourselves in between psychiatry and general medicine.
Mm-hmm.
And whether the journals that we subscribe to as a college cover some of the general medicine aspects as well, or will people that just have access to the college Athens account struggle to gain access to some of the physical health journals that are out there?
The journals that we specifically buy are all psychiatry, but the journals that come bundled into the databases generally are much wider spread between general medicine and psychiatry. So we do have access to a lot of general medical journals, but that said, our speciality is psychiatry. So you may be, if you have a physical medicine question, better off asking your NHS access if you have it. If not, please do come to us. And even if we don't subscribe to it, that's a good thing for us to use an interlibrary loan for, because we have links with many NHS libraries and we can just ask them for it. The same way that they ask us for psychiatry journals if they don't have access.
Great. No, thank you for that. And this isn't a question, but I suppose you've made it very clear that people can ask for advice from yourself and the library team. Could you maybe just tell us what services the library do offer so that people on this webinar know kind of all of the vast array of things that you can support them with? Because probably like me a few years ago, you kindly can support us a great deal with lots of things, and we just don't know about it. I know it's on the website, but we don't go and have a look. So would you mind telling us now, Fiona, just some of the things that you do in the library that could be helpful?
Yeah, of course. So I'm very happy to help with, a lot of things. So literature searching is a big thing that we do. So if you either in your work personally, or if you're part of a committee, or you're working on a book or a journal article, need to access those databases and run a systematic search, then I can do that for you. and we'll send it out to you, and you're welcome to sort of get in touch. We'll set up a meeting, discuss what you need. I'll run it for you and send it to you. We do the interlibrary loans. That's somewhat limited. We reduced it slightly during COVID because they're very time intensive to get our hands on, but we're still happy to help. We do book loans. We send them out for free in the post. That has been going on during COVID. It's just not going on during the latest lockdown because the college is being really careful about who they allow into the building. Currently, it's not me. So yeah, usually you can ask us for that. We're also really happy to do training. I've done a lot of one-to-ones. If you have questions, if you're getting really frustrated, please let me know. You can share your screen with me, show me the problem, and I'll either be able to fix it myself or I'll refer it to the publisher and tell them that something is broken and they need to fix it. And it does happen, so please do tell us when it does. I think that's about it.
Well, that's a lot. Yeah. That's an awful lot that you can help us with. No, so thank you for going through that. Maybe there's a couple of minutes left for just a few questions that have just popped in while we were talking then, Fiona. And one that I quite like actually here is there a place for Google Scholar? I wonder what your thoughts are on that as an engine to use.
I might, get kicked out of my librarian professional body, but I actually really like Google Scholar and Wikipedia. Big fan of Wikipedia. Google Scholar I use primarily for citations. So one good thing to do, especially if you're having trouble finding enough evidence, is to trace the references and the citations of a good paper. And the citation databases are some of the most expensive. So unless you're part of a university, you probably won't have access to them. But Google Scholar does really good citations. So you can find your article, click on the citations, and it'll show you everything that's cited that article. So that's my favorite feature of it. But I definitely wouldn't steer people away from it. It's just the problem that you have if you enter through Google Scholar or PubMed or Google is that you don't know what you have access to, which is why I encourage people to come through us or through the NHS. Because then you don't get stuck in that loop so often where you're entering your password and it still won't let you in. So you enter it again and then it doesn't do anything. That's the problem you'll get with Google Scholar.
No, thank you for that, Fiona. Good. So sometimes when I use it, I'm not using a bad engine because sometimes it's just that bit easier, isn't it, to use Google Scholar. Yeah. A couple of questions have come in around access, and I'm sorry if you've covered this because I think you did earlier, but just to clarify for people, for the BNF, you've said that it's now available, and I know you can get it as an app on your phone because I have the BNF app on my phone, and you've said that you can also get it through the NICE website. Is it available for people not in the NHS? I think it is because I don't think I've logged in for the app on my phone, but I'm wondering if you know.
I honestly would need to check because the last I heard of it was at least a year ago when I spoke to their rep when we stopped subscribing to it. And we stopped subscribing to it because I realized I could get it through the NICE website. So I said to them, why are we subscribing to it? Why are we paying for it? And it wasn't cheap if you can get it free of access. And he said, oh, there's a note on that saying that you shouldn't use it if you're not NHS, which I found very confusing. So possibly you're not meant to use it if you're not NHS, but I'm not clear on that. So not one I can answer for sure.
Maybe we can go and have a look. Like I say, I think I have an app on my phone that I use, and I'm pretty certain I have not logged in for it. So, but we'll go away and have a look, Fiona, and perhaps we can put that up on the website. Because a couple of people have voted that the most popular question at the moment.
I'll query it with is it the British Pharmaceutical Society that publish it? I'll check and clarify it on the website.
Lovely, great, thank you for that. And I guess just another question regarding access is the UpToDate. Is that available to the NHS? Do you know about that one? You talked about it at the very start.
Yeah, it's a trust by trust basis, but UpToDate is very expensive. So I would be surprised if many trusts are still using it, given that BMJ Best Practice is free for them, because HE have purchased it for all trusts. So it's possible that there's a trust out there who's got one point of care tool for free and is choosing to spend that much money on another one, but it's unlikely.
Great. Well, Fiona, I'm just looking at the time and we are coming up to 5 p.m. There are a couple of other questions on there, so maybe we can take those offline and we can pop the answers up on the website.
Sure. Well, thanks for listening, everyone.
No, Fiona, and can I just say on behalf of everyone watching and on behalf of the PTC, because I know for trainees this would have been really useful as well. Thank you so much for agreeing to do this last minute and put this on in a different way. It's not easy doing this with not being in small groups and doing it on a webinar. So as always, you're always great with the PTC and advocating for trainees. So thank you so much for doing this today and giving us your time. It's been really helpful.
Thanks.
No, thank you. So I think that brings us to the end, everybody. Thank you for watching. Thank you for being here. It's a really busy time at the moment for all of us. So giving up an hour on a Thursday, I know is not easy. So thank you for being here. I hope you have a lovely evening and I look forward to seeing you soon at another college event over the coming year. Thanks everyone and have a good night.